how to help a horse with sore back muscles, alternative therapies, stall rest, exercise.
Right. The first thing I would say is you got to work with your vet and make sure that your horse has sore back muscles, right? My friend and colleague and Olympic veterinarian, and I think he's also the chair of the USEF Drugs and Medications Committee.
Oh.
Yeah, pays to know good people.
Yeah, seriously.
Dr. Ken Allen. He has this great quote, and it's absent a diagnosis, surgery is trauma, medicine is poison, and alternative medicines are witchcraft.
Huh.
So his point is get a diagnosis. Yeah. Because a sore back can be a primary condition or it could be a secondary condition.
Symptom of something else.
That's right. And if you can work on the back all day, but if you don't treat the underlying cause, the back will continue to be sore.
And sometimes I think people feel that they'll spend less money by, I'll just do this or that. And
it's the other way around.
Yes, you end up spending more.
And time.
Yes, over time, versus just spending the money, finding out what it is, and then treating that and being done with it.
The other things that are important is there is on our website in the Horse Health Library a really good article called Horseback Pain. And you could find it under the joint and lameness category. And it says, there's a quote, the majority of back problems are bony in nature, but they're always combined with soft tissue damage. So if you've ever had a back problem, it may have started with a bony, like a herniated disc or something with your spine. But then your muscle goes into spasm. All right, that's the issue.
Where you can't move your neck.
Because once your muscles go into spasm, it doesn't matter almost if you fix the bony underlying problem, you got to release that muscle tension. Yeah. So we brought a couple things. There's that one. There's a Back on Track here. There's the Rambo.
So yes, we have the Rambo Ionic Stable Sheet.
Yeah, and this is the
Benefab.
Benefab Rejuvenate Smart Scrim, ceramic and magnetic. So there's a couple of these that can help you or help your horse when you've got that diagnosis and you know what the primary problem is, and these might get you back to performance, help you, rehabilitate the horse and get him back to where you need to go. But so the bony in nature, like what do you think of when you think of a bony in nature back problem, kissing spines?
Yeah, absolutely.
So you got to make sure that that's not going on. But there's some other things that maybe you don't think of that can also lead to back pain, like saddle fit.
I was just going to say.
Okay, yep. Rider imbalance. So the saddle can be balanced, but the rider cannot be balanced. Even certain disciplines, poor conformation, lack of adequate shoeing, like the shoeing and trimming is not quite right. They're not conditioned for the work they're doing, and therefore they get sore. And then even a poorly fitting blanket. You've heard the ones that pull down on the withers, and they wear them all winter, and then they're sore.
Well, it's like if you wear something that's like too small and like you can't move in it, it just stiffens everything up. Yeah.
So as far as other therapy options, ones that your vet might recommend as you're working through the treatment, they can inject steroids into painful joints in the area, just like they do for your legs, your hocks, or whatever. Non-steroidals like bute, Banamine, Equiox might be prescribed. There's muscle relaxants to help break that cycle of spasm. There's something called mesotherapy, and this is where it's a device. It's tiny injections into the middle layer of the skin. It's a pain dampening technique. And so the middle layer is called the mesoderm, so then it's mesotherapy.
Okay.
Yeah, so that's common. And then the alternative therapies, I think, would be like chiropractic, acupuncture, massage. There's therapeutic ultrasound, and all that. There's some hormone therapy that can help improve muscle tone.
Okay.
If lack of tone is the issue.
Would that be like for more senior type horses generally?
No, not necessarily. It all depends on what the primary issue is. Shockwave therapy can be used. And then I think she mentions rest. Like she says stall rest or exercise. I found an article and the title says it all. It says, time heals, but good care helps. Layups benefit from an accurate diagnosis, healing nutrition, proper therapy, and patience. 30 years ago, if you broke your leg, this is a quote from Ken Allen, you sat in your butt until it healed. Today, you're in therapy almost immediately, right? They keep you moving, and they tell you, even with human back pains, the worst thing to do is to rest or to lay in a bed.
Because then everything stiffens up even
Yeah,
more.
you get up and move around. It's the same in horses. But again, and I really feel like I'm harping on this, you've got to have that diagnosis. You've got to make sure that what you're dealing with is something that's going to be okay with movement.
Yeah.
And then let your vet, who may refer you to a rehabilitation, a vet board certified in rehabilitation, let your vet set the program of what needs to happen, like what kind of movement and for how long and how many days in a row.
Because for some things, work might be beneficial.
Exactly.
Other things, work might be detrimental.
Yeah, and some things, activities you want to do every day, and some you want to skip a day. So there needs to be a program developed by your veterinarian and maybe a team of healthcare professionals.
And I do love that you mentioned saddle fit, because that is one where I think we all make the mistake where we just put the saddle on, assume it's good, and over time of having that incorrect fit, it does create some issues in
The
discomfort in
horse's
horses.
back changes, the saddle changes, the rider changes. So yeah.
We do have actually a bunch of videos that we just filmed for Ask the Saddle Fitter.
Yeah, they're very, very good.
They're very great. So definitely check those out. We'll put some links in the description so you guys can kind of take a look at those as a resource.
The last thing I want to mention before I forget is one of my favorite books. It's maybe my second favorite book. It's by Dr. Hilary Clayton, who I've mentioned before, and Ralph Stubbs. It's called Activate Your Horse's Core, Unmounted Exercise for Dynamic Mobility.
My horse and I are both going to do some core
Fabulous.
exercises.
Strength and balance. They found exercises, they've proven by research, they've done, these are published studies, that certain like carrot-baited stretches can not only stretch out the horse, but strengthen muscles that might be unused and horse just forgets they have them, like many people do, and don't use their core. So we get the horse, we remind them, you have these muscles, use them, and then it helps them with kissing spine or other back problems.
There are some really cool exercises out there for horses to do, carrot stretches being one of them, the pull work, things like that to really get them engaged certain muscle groups. So absolutely. Well, hopefully that helps you out. That's a lot of great information, but definitely get your diagnosis and then go from there, and hope you guys will be back to riding soon.